We took a qualitative approach and we looked at the survey responses to a question that asked about rare disease challenges broadly. And we focused on the 384 participants' responses that had talked about some form of stigma based on a previous coding scheme. And this represented 178 different rare diseases. So we found some interesting things, mostly within these three themes of structurally enacted stigma, interpersonally enacted stigma, and felt stigma. And I guess to go a little bit more into that, so structurally enacted stigma occurs within a societal structure, and some of the main areas that participants talked about was healthcare stigma, so experiences with healthcare providers that were not affirming, they weren't informed about rare diseases, not really willing to learn more. And then also some about health insurance, not being willing to cover rare disease related treatments. And then education and workplace stigma was another area that came up a lot. So participants being run out of jobs because their employers weren't willing to accommodate their access needs. And then also needing to leave academic programs because they weren't able to continue on given a lack of accessibility. So those were three of the main areas. And then we also had a code that covered a general lack of accessibility, and that related to different difficulties related to dietary restrictions, mobility issues, sensory difficulties, and the ways that those different things, the world is not accessible to people who deal with those challenges. So that was one of the big areas. And then for interpersonally enacted, it was more about the one-on-one interactions in their day-to-day lives. So things like insufficient social support. Given the rare nature of rare diseases, it was hard for them to find people who had the same rare disease, and that was sometimes isolating. It was also sometimes their loved ones were not supportive, were kind of like emotionally withdrawn about it, or provided inappropriate support. So things like providing unwanted advice about natural remedies or fixes, things that they didn't really have the expertise to be recommending, but they would anyway. So that was frustrating for a lot of our participants. A lot of them also talked about generally like a lack of understanding from other people, sometimes being called a hypochondriac, being told that they were faking their symptoms for attention, and that was a pretty common concern. And then the last area within interpersonally enacted was capitalist norms, and that kind of looks a lot of different ways, but that included productivity, self-sufficiency, and independence, and participants feeling like if they weren't able to provide for themselves financially and weren't able to work full time, and needed help around the house with things, that they were not worthy, they were not good enough. So that was that area. And then finally felt stigma, more about the ways that people with rare diseases internalize negative beliefs about themselves, or about their rare disease, and then also living with this expectation that they're going to be discriminated against because of their rare disease, and the ways that that impacts how they interact in the world. So the two main things people talked about was shame. So that was pretty common in people with more visible rare diseases. They talked about feeling shame about how they looked or acted or spoke. And then also this pressure to be seen as able-bodied, to hide their rare disease from people, usually because it made other people uncomfortable. So those are some of the main areas that we focused on. And it was really interesting to be able to read so many people's stories and to see these themes across 178 different rare diseases, but there were some really notable shared challenges.